Hi, this is Dr. Hammad. Today we're going to talk about back pain, and specifically we're going to talk about back pain generators. The reason I picked this is because back pain is very common amongst people, and there's a misconception that if I have back pain, then I have a disc. There are several back pain generators, up to 14 of them, and each will present differently and at the same time is treated differently. I'm not trying to produce this video so you can diagnose yourself. It's merely a guide for you to have an idea what might be causing your pain. But I strongly advise that you see a physician or a specialist for better accurate diagnosis and better treatment. The first generator that we're going to talk about is muscle sprain or muscle spasms. Typically, muscle sprain or spasm presents with a constant pain localized to the area, if it's the neck or the mid-back or the lower back. It does not radiate, does not cause any numbness or tingling sensation in the extremities. It does not cause any other symptoms other than constant nagging pain. And most patients will differentiate a spasm pain from a different type of pain. Typically, this pain is constant. It gets slightly better if you hold still and not move. This pain is usually treated with muscle relaxant or anti-inflammatories. It goes away with rest or possible physical therapy within days to weeks. The second generator is a thoracolumbar ligament sprain or tear. The thoracolumbar ligament is a huge ligament that connects the entire back from the neck all the way down to the back or to the sacrum. Typically, if you injure this ligament, it will produce pain. And the typical movement that injures this ligament is when you bend down to pick up something and you rotate and you pick it up the wrong way. Most patients will hear a pop in the back thinking that this is a disc. And typically this is a tear or an excessive stretch of this ligament. The pain is usually constant, very severe, exaggerated with any movement. Usually the person will hold still so to prevent worsening of the pain. The key here that it does not radiate to the lower extremities. It does not produce any numbness and tingling sensation to the lower extremities. It is best treated by stretching exercises. You can take a muscle relaxant, you can take an anti-inflammatory, you can get a trigger point injection, but typically this pain will subside within 3 to 4 days. The third pain is what we're going to talk about it, which is extremely important, is a facet pain syndrome. The facet joints are these tiny joints that extend the entire length of the spine. The purpose of those joints is to stabilize the spine posteriorly. Therefore, when you move your spine, it is flexible and it moves with it. Typically, this joint, it has a capsule around it, a true capsule and a true joint. Typically is affected either from osteoarthritis that hits the joint, rheumatoid arthritis that can hit the joint, or if you have any trauma, such as a fall or a car accident that can stretch the capsule and stretch the joint itself. The typical presentation of this pain is usually a deep nagging pain, aching pain that is localized on top of the facet joint itself. Rarely it radiates. The pain is a lot worse when you sit or stand for any period of time. It gets better when you lay down because you take the weight off of that joint. Typically, this joint is treated with physical therapy, anti-inflammatory, possible injections, and there are different ways to inject it. You can go inside the joint intra-articular with cortisone. You can go inside the joint intra-articular with PRP or platelet-rich plasma, stem cell. Or you can go through a radiofrequency where each joint is supplied by a very tiny nerve. It's called the dorsal median branch. And if you go block and burn that nerve, then you get rid of the pain that is generated from that joint up to a year or 2 years. Now, the next pain generator that we're going to talk about it is the disc pain. The disc is essentially, I always describe it as a donut. It has a fibers on the outside. It has a nucleus that is filled with gelatinous material. It is essentially a cushion where that cushions the vertebral bodies. So basically it holds the weight of the body. So typically each disc, behind it there is a nerve root. That nerve root supplies the extremities in a particular way. So anytime you push on the nerve root, you're going to generate pain. There are different diseases or pathologies to a disc. It can be degeneration, which might not cause any pain. It can be bulging, and bulging might not cause pain, but the minute it hits the nerve root, then it will generate pain. It can be a tear within the fibrous tissue, and this tear might not generate pain, or it can be generating pain specifically over the disc area, described as an ice pick in the back. And the tear can extend to reach the nucleus, and the gelatinous material can seep out, and that's called herniation. And of course, the gelatinous material, when it touches the nerve, is going to irritate it and is going to cause pain down the extremities. And of course, there is something called sequestering, where the gelatinous material might break off and fall on the nerve root, and that can also cause pain. Disc pain, usually described as an electric-like pain that radiates down the extremity in the distribution of the nerve root that is affected. It can cause numbness and tingling sensation in the extremities. It is a lot worse when you lay flat on the back, because when you lay flat, you narrow the neuroforamina more, and therefore you push on the nerve root more, and it generates worse pain. This pain is usually treated either with medication, and you can use a neuropathic medication like Neurontin, Lyrica, or antidepressants, anti-inflammatory, opiates at times. It is treated with physical therapy. You can treat it by doing epidurals, where you go with a needle under fluoroscopy at the nerve root itself and inject it. It can be treated with decompression, where you pull the vertebral bodies apart, and that creates a suction phenomena, and the disc sucks off the nerve. You can actually do coagulation to the disc, a thermal coagulation to the disc with plasma heat. You can do endoscopic discectomies, you can do laminectomies, you can do fusion. There are multiple ways to treat disc pain. The SI joint pain, or the sacroiliac joint. The sacroiliac joint is a huge joint where the sacrum with the entire spine sit on the pelvis. That it creates the sacroiliac joint. The sacroiliac joint is covered with large ligament, and essentially any instability in gait will cause irritation of this ligament, or any osteoarthritis of the joint will cause the SI joint too. Typically, the pain is described as a deep, aching, nagging pain that is in the buttocks area or the lower back area. A lot worse when you stand or walk. It gets better if you lay down, because you take the weight off of it. A treatment of the SI joint is either with physical therapy or medication, and it's not very successful. But the best treatment is with intervention, where you can actually go inside the joint and inject it with either cortisone with anesthetic, or you can inject it with PRP, which is platelet-rich plasma. You can inject it with a stem cell. You can do radiofrequency of the nerves that supply the joint, or at times, in worse circumstances, when everything fails, you can fuse the joint too. Now we move to a very important pain generator, which is a compression fracture. A compression fracture, essentially, it's a fracture of the vertebral body where it compresses, and if it compresses, it can cause severe pain. There are different causes of compression fracture. One being, and very common, is osteoporosis. And that's why we advise for women or men over age 60 to be checked for osteoporosis regularly, to treat it so you prevent fractures. It can be due to a trauma, and essentially could be a fall or a car accident, and also can be due to what's called a pathologic fracture due to a infiltration of a tumor or cancer in the vertebral body causing fracture. Typically, the pain is sudden onset, very acute, severe pain, localized over the compressed or fractured vertebral body, and it's constant. It doesn't go away if you lay down, if you sit, if you move, it is constant. Treatment, usually either with medication or a bracing, and at times it's not very successful. You can treat it with what's called kyphoplasty. Kyphoplasty, essentially you insert a needle into the vertebral body, and then you inflate a balloon to expand the vertebral body, and then you inject special cement to hold the vertebral body. That's usually immediate effect in terms of pain relief. Now, there are also other causes, including visceral pain. Visceral pain can come in from the intestines, from the kidneys, from the uterus, from the bladder. If you have infection, or if you have any pathology such as tumor inside this viscera, it can extend into the back and cause back pain. So typically this pain is usually constant pain, and also associated with other symptoms related to the organ that is affected. So treatment, you have to treat the cause of causing the organ pathology, and therefore you treat the back pain. And of course, autoimmune causes to back pain, especially rheumatoid arthritis or ankylosing spondylosis, which is an autoimmune arthritis of the spine itself. The pain generated from these disorders is usually deep, aching, nagging back pain that is a lot worse in the morning, and it lasts for more than an hour when you wake up in the morning. And this is the key differentiating factor, is the pain lasts for more than an hour before it gets better early in the morning. To diagnose this pain, you need imaging, and you might need some blood test or genetic test to confirm the diagnosis. And treatment, of course, you have to treat the disease itself, the autoimmune or rheumatologic disease, to improve the back pain. A psychogenic back pain, essentially pain that is not related to an organic or mechanical cause to the back pain. Typically, the pain is vague, the pain is constant, and of course is associated with other psychiatric illnesses, specifically depression. If you treat depression itself, then the back pain improves by itself. This is difficult to diagnose. You have to rule out other causes before you refer to or before you diagnose them with a psychogenic back pain. And again, so the whole idea from this video is to explain different causes or generators for back pain, so you are aware what might be causing your back pain. But at the end, I strongly advise that you see a specialist so you are correctly diagnosed and properly treated. Of course, if you have any questions, please leave them in the comments. I will respond to them personally. And thank you.